Welcome back. My name is Sheldon McLeod. This is Thinking Out Loud. And over the weekend, my wife had asked me about a post she saw on social media about a story of a young mother who had died in the emergency room waiting for care in Amherst. And, well, SaltWire has that story. Aaron Beswick has quite a few details in here. But what's really telling in a lot of ways is the response from the province on this. And in fact, there is some acknowledgement that, the health authority says they cannot comment on individual experiences due to patient confidentiality, saying each time there's a serious reportable event involving someone who has had contact with the healthcare system within NSHA, a quality review is conducted, and it goes on from there. And I question sometimes this need to say it's about privacy when this woman's husband is talking publicly, and the member of the Legislative Assembly for that part of the province is also speaking out on this. The Liberal health critic has also mentioned this as well. Claudia Chender is the leader of Nova Scotia's New Democratic Party. She joins us today. And Claudia Chender, thank you for speaking with me about this terribly sad and tragic event.
Thank you for having me, Sheldon.
When did you first hear the story?
I saw the social media posts like everyone else did. I was also in touch with my colleagues from the Liberal Party and with the MLA for the area who was concerned and reaching out to all parties and all members, I think, to talk about what had happened. And, of course, did read the article with the details. And I think I want to just start, Sheldon, by expressing my, profound condolences, both to the family and also to the community. I know, I hear the emotion in your voice, Sheldon, and I know that you are a volunteer firefighter, and so is she and her husband, and a loss like this is devastating for a community. And so, I think that that's the most important piece of the story, is that no family should have to experience this kind of loss. And I think that's why people are so upset.
What do you make of that comment? And just for the air, for transparency, I'm still waiting to hear the Minister of Health their office is called, and I'm supposed to speak with her later today. But the idea that this is confidential, patient confidentiality, the idea that the province of New Brunswick had incidents where people were dying while waiting for care, and the premier there fired a CEO of a health authority and took the minister out of the portfolio last summer. So what are your thoughts on the privacy part of this?
Well, I think it's complicated. I think, as MLAs, we deal with people's confidential information all the time, and nowhere more sensitively than in the area of health, because that it's very important that people's health information remains private. If we communicate with government around the healthcare situation of any of our constituents, we need fully signed consent forms and all of that. I don't think it applies in this case because, here the husband of the woman who passed away has very clearly wanted to share this story publicly and is her next of kin. And I think, that privacy really belongs to him, and he can determine how he feels about it. But quite separately from that, Sheldon, I think that we have a situation here where the government is going to have to make a decision. And I think the Minister of Health and the Premier are going to have to decide whether they want to just keep telling everybody that things are good and that they're fixing healthcare, or whether they will kind of own up to the sad fact that things have not improved since they took office, and to talk to Nova Scotians eye to eye about what's happening. We want Nova Scotians to continue to call 911 when they need emergency help. We need them to be able to continue to go to their emergency rooms. The last thing we want is for people to think that they're not going to get the care they need, because we know that the doctors and nurses and medical staff in this province are working as hard as they can. But we know that our system is under profound stress. And I think this should be a wake-up call for this government. And I think this government needs to level with Nova Scotians and tell us exactly what's happening. And particularly in rural emergency rooms, we are hearing very sad stories every single day as elected officials about what's happening. And that needs to change. And I should also say, that we need to also understand what's happening with our paramedics. That is a part of this story, that our paramedics are, the ones who are still on the job are burnt out beyond belief. They don't get paid as much as their counterparts in the rest of the country. They're working double shifts working overtime all the time. And they're run by a private company. And, who presumably probably aren't keeping up to their end of whatever their contract is with Nova Scotia Health, given the challenges we have with people actually getting attended to by an ambulance. So there are lots and lots of questions, and this terrible story raises a lot of them, but they're not new questions. They're questions that we've had for a long time. And this is a good opportunity for the minister and the premier to try to start to answer some of those questions and tell us how things are going to change.
We're a few months away from the spring sitting of the legislature. There will be a budget. There will be a conversation about the direction the government wants to take this province, and there will be commentary about healthcare and about what's happening or what's not happening. But outside of that, what as an elected representative, what is the public? I mean, I'm seeing a lot of people share these stories on social media, but to what end? It seems like the utter faith in the institutions is evolving. It's devolving, but below our feet.
Well, I mean, if your question is what can we do, I think it's really all hands on deck. I think we need to hold the government to their promise. This government was elected on a single issue, and that was to fix healthcare. And that is an incredibly challenging and ambitious goal. But what we've seen in the last year is that it's not just challenging and ambitious, it's absolutely required. And so, hopefully, we can see some results, but we need to understand that. So what we are constantly being told is, don't worry, we're taking care of it. Don't worry, we're spending money. Don't worry, it's going to get better. We recently had an infrastructure plan announced. It sounded good, but it didn't have a price tag and it didn't account for staffing. And those are two massive issues. How much is it going to cost and who's going to work in these buildings? If they're thinking about that, but not telling us, that's a problem. We need to understand. If they're not thinking about it, that's also a problem because it's not going to happen. And so in terms of what we can do is we can keep the government honest. I think everybody in this province can demand that we see the change that was promised to us, because this is, at the end of the day, the change that this government promised, that things were going to get better. And unfortunately, things are getting worse. But in the meantime, people should continue to call 911 in an emergency. They should continue to go to the nearest emergency room if they need care. We have, despite all of the challenges, incredible, skilled women and men working in these institutions who go to work every day to make sure that we, stay healthy and have the kind of communities we want to have. And so we will weather this together like we do in Nova Scotia. But in the meantime, we need to keep this government honest. We need to see progress in healthcare. We need to make sure that we retain the healthcare professionals that we have. We need to make sure our emergency rooms stay open. We need to make sure that when people call 911, they get the care they need. And, I'm a politician. So, my advice on how to do that is political pressure. We need to make sure that this government does what they say they're going to do. And I think that most governments, when they run on a platform, expect to be held accountable. The premier has said that several times. In the end of the day, this stops with me. I will be held accountable. So let's hold him accountable. And, I think Nova Scotians have to speak with one voice and make sure that they are clear that we want a robust, efficient, operational, public, free healthcare system that all Nova Scotians can avail themselves of, and that we can avoid any future tragedies like this one.
The leader of Nova Scotia's new Democratic Party, Claudia Chender. Thank you.
Thank you, Sheldon.
As mentioned, there's been a lot of conversation about this. In fact, there was an ask by the elected representative for Cumberland North to have a meeting with the health minister. And the Honourable Minister of Health for the province of Nova Scotia, Michelle Thompson, joins the conversation. Minister, thank you very much for joining me. I appreciate your availability.
Thank you.
I'm curious if you're in a position to tell me when you first heard about this particular incident.
So I did hear about this tragic situation at the end of last week.
And have you agreed to meet with the minister with the member from Cumberland North, Elizabeth Smith McCrossan?
Yeah, so I know I received letters from MLA McCrossan over the last number of days, and I do know that she's had the opportunity to meet with local leadership, the Vice President of Operations for the Northern Zone, which is the person who can really support making on the ground decisions and changes. So I'm really grateful that there's been an opportunity for those two individuals to meet. I am in my constituency today, and so I have not had a chance to meet with Elizabeth Smith McCrossan.
And will you have an opportunity to reach out to this woman's husband?
So again, I know that Nova Scotia Health has reached out, and I want to be very responsive to the family. Certainly Nova Scotia Health has reached out and had an opportunity to speak with him, is my understanding. And certainly if he wants to speak with me, I'm happy to do that. I have not reached out yet, and continue to listen and hear, and when the time is right, I am sure that there will be an opportunity for he and I to speak.
I want to just for a quick second here talk about the news release, the news story, and the Nova Scotia Health Authority's written statement on Sunday saying that it couldn't comment on individual experiences due to patient confidentiality. And it says each time there's a serious reportable event involving someone who has had contact with the healthcare system within NSHA, a quality review is conducted. What is a reportable event, and who is it reportable to?
Mm-hmm. So there is some legislation around, what serious events, but any time that the health, the health authority or a patient has an unexpected outcome or an experience that is, tragic or difficult, there is a requirement that Nova Scotia Health undergo an investigation, which is known as a quality review. And that process is automatic and certainly was underway last week. And so that review is done internally, and the recommendations from that review are then shared with the immediate family of the patient.
So this family will receive a copy of that document or report once it's finished?
Yes, and in many circumstances, families are involved in the review as well. It's important that first voice is heard and that people have an opportunity to explain their experience, and they are an integral part of that review process when they want to participate.
And I know there are sensitivities about personal medical information, and obviously as a member of the Legislative Assembly, there are times when you would be in contact with constituents. It's completely understandable that there is an expected level of privacy. There's legislation to that end. But should the province of Nova Scotia, in the midst of a health crisis, be hearing about the death of a person in an ER through social media?
So I'm not sure about that question. I don't think that leadership heard about it through social media. I think there are internal processes where leadership was made aware, and those internal processes, one, notified the senior leadership and also enacted or initiated the quality review that we spoke about earlier. The social media, I think, created a broader reach in terms of who was aware of it, but certainly a tragic event like that would have been brought to the attention of Nova Scotia Health as well as the department prior to social media.
And the statement, as I read, was reported to or by someone with SaltWire.com that it was, privacy information. They wouldn't be commenting further. I guess the concern is that if someone is waiting and it's such a serious and devastating outcome like this, that should there not be some type of reporting process? I guess to look to New Brunswick, where they had a similar situation. And last summer, the premier there, not only did he fire someone, he also moved a minister out of the office. I'm not in any way suggesting that should be the case here, but the public confidence in the system, the public confidence in you as a minister, knowing that things are at crisis levels and people are hearing about this, not from government, not from the health authority, but through the husband, the widower of someone who died in an ER.
So those investigative processes are very, very important for us to understand what happened and to look at the recommendations in terms of how we prevent it from happening again. We have said we want to be accountable to Nova Scotians. So as part of the recommendations, we'll continue to look at what is the best way for us to communicate with Nova Scotians while also protecting people's personal information. It is very difficult. People express in different ways, and what's appropriate and helpful helpful and healing, and part of advocacy for one family may not be the same for the other. And so we need to be really sensitive, always working and being responsive to the needs of the people we're caring for to the very best of our abilities. So, that's something that we can look at. But I think that, we need to be very sensitive and careful about how we continue to do that.
Does it, in some ways, seem off to you that the privacy of a deceased person is being protected? Who's being protected by not talking about this publicly through the health authority?
I think that there are, situations, again, we have laws that we have to follow. They're not arbitrary, and we continue to work within the legislation that we have. Again, how are we accountable to Nova Scotians? It's very important, and we need to find ways to do that in a way that is respectful. So there are some families who want that situation identified, and there may be other families who do not. And so we continue to understand how to strike the balance between the needs of the family as well as the legislative requirements that we have.
And I have been communicating through social media, through private conversations myself with this woman's widow, and Gunther Holthoff asked what he'd like to hear from you, and he wants to hear that there's something being done where if people are in a position where they go and they need help, that they're not waiting in an ambulance or waiting in an emergency department. He'd like that assurance. So what can you tell him through this process or through this platform?
So I do want to assure him we are very, very upset and sorry for his loss. This is a devastating event. We do need to understand what happened, and we want to understand how to prevent it. And the recommendations will be important. We are committed to transforming healthcare. We know that the system requires significant investment and change, and we are committed to doing that. And I want to assure him that we are unwavering in that commitment, and we will continue to do whatever we can to make sure that emergency rooms and the healthcare system is responsive and ready for Nova Scotians.
And there was a strong suggestion this is a staffing issue. I don't know if that's the case. Obviously, that's what this investigation will suss out. Any comment or thought about what in the interim, what in the immediate can be done to help, at least in some ways, ease some of the pressures on the emergency departments, the staff who were working there, and obviously the patients who are trying to get help?
Mm-hmm. So I know that local leadership, certainly following the event, has been in contact with the frontline staff, understanding the circumstances in the department that day, but overall understanding what are some of the things that we can do to support that clinical team in delivering safe and timely and effective care in that environment. So we're going to work very closely with them, that senior leadership team, to support that environment. We know that it is under strain. They're in a new location for a period of time. So there are a number of things that we want to be able to do to support them, and we'll continue to work with them because, what I do know as a former healthcare worker is that staff will have felt this loss deeply as well, and so we want to continue to support the family, the community, and the healthcare team as we move forward.
I don't think there's any question. A lot of people want to hear from you. I can tell by your email that there are lots of messages coming in, and as a Minister of Health, I can't imagine what it was like for you to learn of this situation, and obviously what the steps are next to address it to prevent something like this from happening.
It's a very big responsibility. It's not one that I take lightly. It certainly is not a responsibility that the Premier takes lightly. We are very upset and heartbroken for this family. And, again, to reiterate our commitment that we want to transform and improve healthcare. And, we will continue to work very, very hard to do that.
The Honourable Minister of Health and Wellness for Nova Scotia, Michelle Thompson, thank you so much.
Thank you.